First of all, I would like to thank the organizing committee to invite me this August gathering. My topic is Epiduroscopic laser ablation of Sinuvertebral nerve for discogenic back pain. We know that discogenic back pain is axial pain, is a pain at the lower back without radiation, and it is not associated with any deformity and residual instability. And pain is worse in the morning, and also with perceptual phenomena like coughing and sneezing is aggravated by stunning in the flexion. And incidence is 26 to 42%, and diagnosis can be made by the probability discography. Pathophysiology is still unknown, but there is a hypothesis that is due to the internal disruption with a cascade of inflammation inside, and there is an ingrowth of the nerve inside the tail, and there are two types: annular due to related annular disruption, or is related to the in-bed problem. Before going to the pathophysiology, we know that the discs are innervated by the sinuvertebral nerve in the posterior aspect. Initially, it is believed that the disc is an organ that is probably innervated, and supplied only by the sensory and sympathetic nerve. And one of these is the sinuvertebral nerve, and it is a bridge connection between the spinal nerve and the sympathetic nerve. And ventral and the dorsal branches of the sinuvertebral nerve, they connect and work as assist in the segmental function. So this is the schematic representation. Here we have the one with the normal disc here. There is internal derangement. There is a tear that leads to the granulation tissue and neural tissue ingrowth in the disc that leads to the discogenic back pain, and which is supported by the histologic of the pathological symptomatic disc. There is an ingrowth of the vessels, and there are also ingrowth of the nerves also, which is also supported by the finding the substance like substance P, vasointestinal peptide, and neurofilament, which are responsible for the pain in the disc, which is not found in the just degenerative or symptomatic disc. And there are different type of treatment available for the discogenic back pain so far. Traditionally, we have the conservative treatment, but it helps only in the 13% of the patient. And there is a fusion. We can do the fusion, but complications are not negligible. We can do the disc replacement, but we should be prudent because the harm and complication may occur after some time. And there are alternative treatments like interdiscal therapy, right? Interdiscal therapy, but the evidence is level 3, and the outcome is not more than 50%. And there is another treatment called bypoplasty. There is only the 40% improvement in the pain by this technique. And recently, there are 2 clinical trials, the injection of methanol injection and mesenchymal stem cells. They are still in the trial phase. And most recently, there is we have published this transparency laser ablation of the sinuvertebral nerve, and this is published in the Central European Neurosurgery Journal last year. Here we need the sophisticated instrument like the laser degenerator. We need the laser fiber, which is a side firing only, and we need the epiduroscope, and also we need the cannula, which is just about 3 millimeter there. And it is done by going to the in between the PLL and the annulus posteriorly, where the sinuvertebral nerve is located. And we have studied about 52% and about 56% with the female, and age is between the 42 to plus minus 11, and follow-up is more than 15. And there is a significant decrease in the VAS, significantly, which is statistically significant, and there is a decrease in the ODI. After this procedure, this is also significant, and the result, according to the maximum criteria, is 96%. And the conclusion of that article is that tailor targeting to the sinuvertebral nerve was effective with 96.1%, good to actually result with immediate decrease in low back pain. Take-home message is tailor is promising percutaneous technique for discogenic back pain. Thank you.
Thank you. So we have one procedure for. Are there any complications?
Yeah, there are 4 transient motor weakness which improve in 4 weeks' time. Just transient in 4 cases only.
Anybody in the audience who does this procedure? Because I don't have personal experience.
I have a question.
Yes, Manoj. Dr. Said.
Is it endoscope?
You're ready.
Is it blind or?
No, it's endoscope, epiduroscope. It's an endoscope with a 3 millimeter channels that we can pass the working instrument from that also.
No, but if you are going beneath the PLL, you won't be able to see the tip of the laser.
Yeah, we can see. Because of the constraint of the time, I didn't show the video. We can see everything through the endoscope. Thank you.